The biggest concern that patients have in regards to implants is the amount of pain they be in. I mean, there are countless times where I had patients come in and say, look, I've been putting this off for 7, 8 years because of the amount of pain they're dreading of having after implant surgery. So, dental implants, yes, when we first used to do it, it is quite painful because you have to cut the gums open, lift everything back, expose the bone just to see where you're going to do the surgery. So after all the surgery is done, the drilling, the checking and the stitching back up, the patient's usually swollen and in pain for the next 2 weeks or so. So nowadays, we have a very different approach ever since about 3 years ago, since 3D digital technology for dental came out. So we have a 3D X-ray, so we can see everything in the 3 dimension. We have a 3D scanner, so we can scan the patient's teeth in. Then we can actually design the patient's implants in the 3D jaw before we even start doing any surgery. So in these kind of cases, we have very high precision and accuracy to see where the implants are going to go, so we can plan for how the teeth are going to go on later. Once we plan it, a 3D guide comes back with little rings on it to prevent any sort of mishaps during surgery, because the drill cannot go anywhere else apart from where the surgery kit is. So every time we drill, we know exactly where the drill is ending up. Once the implant goes in, because we didn't even open up the gums to do the surgery, because we know where it's going, there is very little pain. It's almost as if like you're eating something and something sharp just nicked your gums. That's as bad as the pain gets. And because we're not even opening the gums up, the chance of infection is a lot lower. So that way there's less chance of complications or redoing the surgery as well.